Your break was how long? Hi guys, and welcome back to the Mama Nurse channel. I'm Vanessa, and today we're going to be discussing nursing basics, nursing 101. So these are things that you don't learn in nursing school that most nurses, once you get to the floor, they're going to expect you to kind of know these things already. So I'm going to give you a few tips, FYIs, and just things you should know before you hit the ground running as a new nurse. So as always, don't forget to like, comment, and subscribe. Go ahead and hit that notification bell so you can be notified every time I drop a new video. So these tips and FYIs are in no particular order, just things that over the years I've learned and be helpful for you. First things first, don't lie. We know that dried up poop didn't just happen, and it happened hours ago and you didn't get around to changing that patient. I always say, just be honest. If something didn't get done, just let me know so I can add it to my task list rather than going in to do my assessment and getting surprised by something that wasn't told to me in report. This brings me to my next point. Nursing is 24 hours. If you don't get to do something on your 12-hour shift, then it automatically gets passed on to the next shift. Sorry, it's just the way that nursing is. Don't feel like you have to get everything done. You want to get the most important things done or something that the doctor told you specifically to do. Try to get those things done. You have to learn how to prioritize, but anything that falls outside of that 12-hour range, 12-hour shift now falls on to the next shift for them to complete it. So it's around the clock. If you don't get to finish it, just pass it on so that your oncoming nurse knows what they need to get done. We know when you take a 45-minute break. Simple as that. Doctors would much rather you say that you don't know and you'll find out the answer or you'll find the information that they're looking for rather than you trying to lie or BS your way through things. Doctors can respect honesty, they don't respect liars. Doctors also know who really takes care of their patients. It's very evident the nurses who care about their patients and opposed to the ones who are just there, whether it's for a paycheck or they've just outlived their time on that unit. It makes a difference, and doctors are more in tune and more respectful to the nurses who take care of their patients and are diligent with the work that they do. This is almost a no-brainer, but I still see this going on nursing units. If you don't know how to do something or if you don't know something, just ask. Once you get to your nursing unit, find somebody that you feel confident asking and talking to, because that could be your go-to person, whether it's your preceptor or somebody that you went to nursing school with or somebody new that you just formed a bond with. But find at least one or two people that you feel comfortable going to ask, and make sure that you are asking questions before you do things that you are not familiar with. It's okay to ask. It's better to ask rather than hurt your patient, hurt yourself, or lose your license. You worked hard for your license, so make sure that you are protecting it by all means. Don't be a know-it-all. Be open to suggestions and constructive criticism. You're not going to do everything right as a new grad coming out of school and starting on your first unit. It's okay, but just be open to suggestions and recommendations from your peers around you. In the same lines, don't eat your young. This is for new and experienced nurses. New nurses come around, everybody expects them to know everything right away, and that's not the real world. You have to learn, you have to adjust, and you have to accommodate. You have to figure out, how you're gonna be as a nurse and everything like that. So just make sure that you're mindful of that. The reason why I say that is because a new group of nurses comes in, you have your seasoned nurses who will nitpick on little things that they do, but you need time, in all honesty, to grow and to figure those things out. Everyone starts at the bottom. Help your peers grow, because next thing you know, they're going to be a nurse right next to you and you might need to call on them to lend you a hand. Help others, be open and be helpful around your unit. It's so much easier to be working next to a nurse who is willing to come hold the patient over so that you could clean them or whatever the case may be. If you're standoffish, nobody's going to want to work with you, and it makes your job harder. Nursing is a team effort, and you always, not always, but you do need to have somebody that you can rely on that will come help you in a time of need. Reciprocate the help as well. So if I help you, you come back and you help me. And last but not least, clean your station and clean your supplies. Once you get reported and everything like that, before you start your shift and go in to your rooms, wipe down your station, wipe down the phone that you're going to be using, wipe down your computer and your desk, whatever workstation you have available to you, wipe it down. We have purple Sandy wipes. We have orange bleach wipes that you can use and wipe everything down. Be clean, be tidy, and protect yourself and your patients. You don't want to sit in an area full of germs. You take that back home to your family. So before I even start my shift, I wipe everything down. That way I can feel comfortable to go through my 12 hours and have a clean environment around me. So what nursing tips do you have for the new grads coming in this year or the beginning of next year? Go ahead and drop your tips and FYIs down below so that we can help out our fellow nurses or soon to be nurses. Don't forget to like, comment, and subscribe. Hit that notification bell so you can be notified every time I drop a new video. Until next time, stay safe, be well, and live life.